Today we're going over the semitendinosus and the semimembranosus. These are hamstring muscles. There are 3.5 hamstring muscles. We have the semitendinosus, we have the semimembranosus, the bicep femoris, and also the short head of the bicep femoris. That's the half of the other three. So today's going to be the semitendinosus. Now, the actions of the semitendinosus are going to be hip extension, knee flexion, and it's also going to do medial rotation of your knee in the open chain. And we're going to go through all these real quick. So we have hip extension, as we can see there. We're extending the hip. Get a side view for you. Knee flexion. Flexion of the knee, we can see that right there. Also going to have medial rotation. Now it's not going to show it on that one, but it will show it on this one right here. And so this is in the open chain. Open chain meaning your foot is not on the ground. So if you're doing maybe a hamstring curl, lying hamstring curl, and you put your feet more in, you're going to activate your semitendinosus, semimembranosus a little bit more. But this is going to be get on the anterior view of this for you. You can see as we go medial rotation right there. Now let's go over the origin and the insertion. The origin is going to be on your ischial tuberosity. Now that is going to be the bottom of your ischium. This is your ischium right here. We have your ilium, your ischium, and then we also have your pubis that's going to be up front. This is going to be your ischium. And we can see where that origin is going to be. We see that's originating right here. And the insertion is going to be on the tibia. Right here. As you can see, that's going to be the medial aspect of your proximal part of the tibia. You don't have to know that for beginning anatomy. That's something you'll have to know for your advanced anatomy. But that is the insertion point because it's going to move the most. The semimembranosus, let's check that little fella out right here. We have that one. It's also going to be your ischial tuberosity. Just a different portion. These are also known as your sits bones right there. And it's going to be the medial condyle of your tibia. A little bony part poking out on that posterior part of your tibia. A little bit more medial posterior area as we can see right here. And that right there is your semitendinosus and your semimembranosus. Remember that your semitendinosus, the reason they call it a tendinosus because it's very tendony, it's very long. Semimembranosus is more medial to your body, so more towards the midline of your body. The nerve innervation for your semitendinosus and your semimembranosus is going to be your tibial nerve. If we look at where the tibial nerve comes from, it's going to be your sciatic nerve right here that splits between your tibial nerve and also your fibular nerve or peroneal nerve right here. So your sciatic nerve splits into these two. Your tibial nerve is the one that innervates your semitendinosus and your semimembranosus. If we look at the nerve innervation path, we can see the sciatic nerve going into your tibial nerve, and that is what innervates your semitendinosus and your semimembranosus. That is everything you need to know as far as the semitendinosus and semimembranosus.